no place I'd rather be.
Guys, but where I was, and I was saying that it was BS that they couldn't test me again. I mean, didn't make sense to me, but I went along with it, went home, was still sick, and I had my 31-week appointment with my doctor a few days later, and my doctor, if you're pregnant or have ever been pregnant, you know that the first thing they do is take your urine, and then they take your blood pressure. Well, when she took my blood pressure, it was already like, oh, I don't like this angle. It was already really bad, and she told me at that appointment, right then and there, that I immediately needed to go to the hospital. They didn't even check me, do anything. They just sent me to the hospital. So I get to the hospital. They did an ultrasound on me and told me that, well, before that they did a blood test and urine test to test for preeclampsia again. And they told, and after they did the ultrasound to make sure baby was okay, and he was okay, but the umbilical cord was slowly getting like nutrients cut off, and this is how they explained it to me. So like, this is the umbilical cord, and it was slowly being squeezed. So they were going to try and make me last until I was 34 weeks pregnant, and they were going to induce me at 34 weeks, and I was only 31 weeks 2 days when I went in. So I was like, great, now I'm going to be in the hospital for 4 weeks. And then the test for preeclampsia came back. And the guy goes, so you have severe preeclampsia? Said, oh really, I do. So I told him that I had been tested at that same hospital multiple times, and they told me I did not have preeclampsia. And obviously they were wrong, because I had severe preeclampsia, and I was pretty much like, if I hadn't gone to the hospital because of my blood pressure, or I hadn't been going to the doctors or anything like that, and gone any other route, I would have died, or my baby would have died. But I'm pretty sure it was more of me, because they told me on the ultrasound baby was completely healthy. He was growing great, everything was going great, only my body couldn't hold him the way it was supposed to. So I stayed in the hospital, obviously, and I had to leave my dogs at home, and I was so upset, and I didn't want to be in the hospital. I didn't want to have diabetes. I didn't want to have to poke myself every day, and the list just went on, and I was getting really depressed. And 3 days later, I just remember, let me just tell you guys, like, I barely remember this, but I was like fine all day, and then one night my like blood pressure was rising, and I was forgetting things. I couldn't even tell you who the president was. I was so forgetful. Like, I literally had no idea what was going on. And so the doctor was giving me labetalol 300, and she kept giving me that, and then she was like, well, that's not working, so we're going to give you more blood pressure medication. So I was on a lot of drugs. So they got to their final straw, and the last blood pressure medication that they could give me they thought that would help me. It didn't help. And I started having a mini seizure, and I was shaking in the bed, and I don't really remember much of what was going on, but I remember my boyfriend hitting the call button to call the nurse, and the nurse came in, and she was like trying to touch me and trying to tell me to calm down, and I was like shaking and told her I couldn't calm down. And I remember her going to call the doctor, and there was an on-call doctor, and it was not my doctor, and he decided he was going to go ahead and bring me in for emergency C-section. So within 10 minutes, I was brought upstairs and laid out on a bed, and I just remember I was really messed up. I was really hurting, And I was really scared because they didn't induce me. I wasn't in labor. I was perfectly healthy, like pregnancy wise. Like I was not ready to give birth. My body was not ready for the baby to come out. I mean, I was only 31 weeks, 5 days, guys. And it was like mid-afternoon when this had happened. And, well, I remember they were playing pop music. And they didn't let my boyfriend in right away. And they gave me like a spinal tap, where the lady puts the thing in your spine and to make me numb from like the waist down, or like mid-stomach down. And I was really, really scared, and they didn't let my boyfriend in at the time. Well, they finally got me on the table laying down and like the tarp up so I couldn't see my area. I'll show you guys pictures at the end, but they finally let my boyfriend in, and I could feel them tugging on my area down there, but like I was numb, so I couldn't feel it. And I remember they took him out, and I can't even honestly remember if he was crying. They let my boyfriend take pictures over the tarp, so just so you guys know, the pictures at the end are graphic. Lots of blood. So don't watch those if you don't want to see bloody pictures. But then my boyfriend went over and cut the cord, and they showed me from like 2 car lengths away. I got to see his face, and they didn't bring him to me because he was small. He was only 3 pounds 11 ounces, and they had to take care of him right away. I couldn't see him, couldn't do anything. And then I remember saying that I needed to throw up, and asked, sorry guys, let me go help him one more time. All right, so let me get a drink really quick. Okay, so like I was, sorry, now my dogs want to be acting up. Come here. Kappa, come here. Come here. Look, I let one of you on the bed, and all of you have to get on the bed. Now, calm down. So, they didn't let me see him, and I remember that I needed to throw up. And I asked the nurse if it was okay to throw up because, gosh darn it, Harley, come here. Come here. Come over here. Oh, you're okay. I'm sorry. I'm sorry, Harley. Say hi to the camera, Harley. You're like, no, God. I'm sorry, Bart. So, sorry. Lots of disruptions around here. So, I remember saying I needed to throw up, and I asked the nurse if it was okay to throw up because I thought if the guy's working on my stomach and my stomach's cut open, how awkward would it be to throw up? Plus, like, you know how it takes stomach muscles to throw up, so I was honestly really scared he'd be using my muscles. And she told me, yeah. And then I just remember her putting something on my face, and I passed out. I have no idea if I threw up or not, to be honest, but I passed out. And like next thing I knew, I woke up and I was like being pushed. Will you guys calm down? Stop. Calm down. Opie, calm down. No. So I was being pushed to a little room so my family could see me. And then my family came and saw me, and the whole next day I couldn't move, couldn't get up, couldn't cough. Oh my gosh, I was in so much pain. I'm gonna get you off the bed if you keep it up. I was in so much pain, and I have so many distractions. I couldn't even get up and go see my baby. All I saw were pictures. And when the nurse showed me him, he was at least 2 car lengths away. And I really couldn't see him, and I was really upset about it. But, so when he was a day old, I went and seen him. He was so cute and little. in an incubator, and I couldn't really do much. And about 2 days later, they sent me home, and I went up. Me and my boyfriend went up every night, even if it was at 10 o'clock at night. We went up to go see him, and he was in this NICU. It's called Sacred Heart NICU. They pretty much make him pass certain tests. There's like 3 tests, but I can only remember 2 off the top of my head. Stop it! Get off the bed. No, you're not gonna sit here and do that. So they had 3 tests, but I only remember 2, like I was saying. And one was the baby had to regulate its body temperature 24 hours outside of the incubator. And then the other was premature babies don't they don't latch onto the milk like as well as like newborns, like they don't get it. And so they had to drink about 50 to 60 milliliters of their milk, like every bottle feeding. They couldn't be tube fed. Well, it took Reese like a week, or no, he was taken off his feeding tube like 2 days before he actually left the NICU. And Reese left the NICU he was born June 3rd, but he left July 12th. He had finally passed all his tests, and we got to take him home, and I was so happy. But about a week later, he started throwing up, and I thought, oh God, what did I do wrong? I have like this little baby, and he's now throwing up brown throw up. So I called a doctor at 4 o'clock in the morning, and they told me to take him to the hospital. Well, sorry, I have really fluffy hair. I took him to the hospital, and they told me that he had pyloric stenosis, which normally happens in baby boys first born within the first 2 months that they've been born. Well, he needed surgery, so the next day he ended up having surgery, and he stayed for about 4 days until he finally started eating right again. And then he was sent home. I was really cautious and really worried, and I just went through so much, and I just wanted him to be healthy, wanted me to be healthy, and I just wanted it all to stop. But luckily after that, everything went good, and now I have a healthy baby boy who is almost 4 months old. And yeah, I'm really happy with the way things are going now, and the NICU experience wasn't as hard as I thought it was going to be. It was just, I'm just really happy now, and yeah. So thank you guys for watching my video. I'm sorry I'm still really awkward and new at this, but thank you guys for watching, and I will show you the pictures now.